Well, thank you very much for joining us today. I'm Karen Giblin. I'm the founder of the Red Hot Mamas. Red Hot Mamas is so pleased to have partnered with Roper Francis Healthcare to bring you monthly menopause education programs. These programs will provide you with reliable information and all the essentials you need to optimize your health and well-being at menopause and beyond. So today, let's talk about sex. Ladies, sex does not have to end at menopause. Yes, some women do fizzle because of some of the changes that manifest during the menopause, but some women even sizzle and enjoy satisfying sex and intimacy well into their senior years. We're pleased to have with us today Dr. Lauren Hamilton. She will discuss the common sexual changes during menopause, strategies for more satisfying sex, and medications for sexual symptoms, especially those symptoms like vaginal dryness related to menopause. Since 1997, Dr. Hamilton has been an OBGYN in Charleston. She grew up in New Jersey, and she is the proud granddaughter of Italian and Hungarian immigrants. They instilled in her a very strong family and work ethic, which influenced her decision to becoming a doctor. She attended Goucher College in Maryland and then obtained her Master of Science in Anatomy from the University of Maryland. She then went on to Tulane University School of Medicine in New Orleans, and she completed her residency at the Medical University of South Carolina. Patients are very fortunate to have Dr. Hamilton as their doctor because she prides herself with getting to know her patients on a personal level while watching them grow through the various stages of their lives. And she regularly treats women who are going through the menopause transition. Dr. Hamilton's medical special interests include obstetrics, vaginal surgery, and laparoscopic surgery. On a personal note, Dr. Hamilton is happily married and has two very lovely young daughters who are in college. But before Dr. Hamilton begins her discussion today about sex, there's a few minor housekeeping items which I must go over. First, the program will begin with a PowerPoint presentation. About halfway through the presentation, we will allow you to write your questions and send them into Angela Poindexter's chat room. Angela is Roper St. Francis Healthcare's Integrated Marketing Manager. Angela will read your questions to our speaker. Of course, your name will never be revealed, so don't be shy and ask a lot of questions. And if you forget to write your questions during our half-time break, you'll have another chance to do so at the end of our presentation. Once again, and then you must write them into Angela Poindexter's chat room. At the end of the full presentation, we would like you to take our short survey, and by doing this, you'll have access to additional resources. So without further ado, let's welcome Dr. Hamilton and let's talk about sex.
Thank you, Karen. Just a little blurb about myself. Karen did such a great introduction, but I want y'all to know that I'm 56, so I'm postmenopausal, and I'm also a breast cancer survivor, celebrating 5 years in October. So this topic really makes a big difference to me, and it's really important. I really like to talk to patients about this, and I really like to help them work things out. So in our discussion today, we're going to review the symptoms of menopause. We're going to talk about why sex matters. We're going to talk about the genitourinary syndrome of menopause, how menopause impacts your vagina, the treatments, lifestyle changes, making sex better, communicating with your partner, and questions to ask your doctor. So just reviewing menopause, there are 3 stages of menopause. I think you're probably all aware of this. There's perimenopause. Perimenopause can occur 10 years prior to menopause, and it is really highlighted with symptoms of menopause that are irregular. People get hot flashes and night sweats. They might find some irritability. They might get some irregular menstrual cycles, irregular periods, and overall just kind of feel a little bit different than they used to. The menopause is hallmarked by the stopping of your periods. Average age of menopause is 52. Fertility ends at that time, and you might get those symptoms much more frequently. Postmenopause is after you've not had a period for a year, and your symptoms such as hot flashes and vaginal dryness continue. Your risk for other diseases also increase, such as osteoporosis and heart disease. Reviewing menopause symptoms, the common symptoms that we hear about in our offices, people get headaches and migraines, they have hot flashes and night sweats, which are also known as vasomotor symptoms. Some people get crawling sensations on their skin. The big one is vaginal dryness. Low libido is a big problem. People get sleep disturbances where they fall asleep and they can't, and they wake up and they can't fall back to sleep again, or when they just have trouble getting to sleep in the first place. There are some mood changes, anxiety, irritability, a little bit of depression for some. You can have some memory and concentration problems, change in bladder function, muscle and joint pains. Really, I hear a lot about the central abdominal weight gain, which is super frustrating to women, dry eyes, and of course, skin and hair changes. Physically, we see a bone loss, and that's osteoporosis and osteopenia. And then there are different things that actually put you at risk for that. Cigarette smoking, thin body, thin BMI, low BMI, things such as thyroid disease, being on chronic steroids can really put you at increased risk for bone loss. And then urogenitally, you see more bladder infections, you see vaginal atrophy where the thinning of the lining of the vagina happens, and you see a lot of stress and urge incontinence. The hallmark of menopause that a lot of women don't know is that our risk of heart disease actually is lower than men until menopause, and then it becomes the same as men after menopause. So that's very important. Sexual health is important at any age. Women enjoy satisfying sex and intimacy throughout their lifetime, and the desire for intimacy is timeless. It doesn't matter how old you are, people want that intimate connection with their partner. Sex can still be very fulfilling through the menopause. It just might take a little bit of work on your partner's part. And it's important to identify the aspects that can change so you and your partner can talk with each other and adapt accordingly. According to a published study, most adults have sex once a week. And it's also reported that people are happier in their relationship if they have sex at least once a week. I, of course, tell my patients, you can't really focus on numbers. What's right for you and your husband is the right number. Some people have sex more often. Some people have sex less often. And, your innate sex drive and your quality of life and your relationship with your partner is really going to drive how much sex that you're having. The top 10 health benefits of sex are listed here. Lowers your risk for heart attack, reduces blood pressure. It boosts your immune system. It relieves stress and improves sleep. It strengthens your pelvic floor muscles because you're using those muscles, which is some muscles that people don't often use. It improves women's bladder control because you're using those muscles. It boosts your own libido. Practice, practice, practice. The more you do it, the more that it becomes more natural and more common for you to do it. And the more you do it, it also lessens the pain of intercourse. So if you're only having intercourse occasionally, the intercourse can be extremely painful. But if you're having it more and more frequently, then the pain is lessened. And it does count as exercise. There is something that is called genitourinary syndrome of menopause. It used to be called vulvovaginal atrophy. And that actually is how your vulva, which is your external genitalia, and your vagina responds to the loss of estrogen with menopause. About 50% of postmenopausal women will experience this syndrome of menopause, the vulvovaginal atrophy, but a very small amount are treated. The women are unaware that symptoms can progress without treatment, and there are safe and effective treatments available. But the earlier that you get those treatments, the better, the more effective they're going to be. Obviously, treatments have impact on quality of life, sexual function, and relationships. And the treatments include conditions of the vagina, the vulva, pelvic floor tissues, urinary tract, sexual dysfunction, and some loss of libido. Menopause is more than just having hot flashes. Menopause really, the decrease in estrogen has a major impact on your sex life. Your testosterone levels also decrease. So if you're dealing with symptoms such as dryness, soreness, itching, and you are embarrassed and they don't discuss it with their doctor, they're kind of in a quandary. They really don't get the information that they need for treatment. Some people think these symptoms are natural and you're not supposed to have intercourse later in life. It's just kind of something that happens, but these conditions are treatable and you should talk to your doctor. Doctors expect you to talk to them about symptoms of menopause, about vaginal dryness, about sexual issues. I'm never surprised when patients bring that up. We actually have it as part of our template in our routine GYN questions, so patients don't feel embarrassed. But if your doctor doesn't have that, bringing it up to your doctor is very reasonable and something your doctor expects. So the genitourinary syndrome of menopause can be caused by aging, but it can also be caused by things when you are younger. If you have both your ovaries removed, some people who are at risk for ovarian cancer have both their ovaries removed, or if they have different type of symptoms like endometriosis, pelvic pain, they might have their ovaries removed. Some people have genetic problems causing premature ovarian failure. That's fairly rare. Smoking can increase your risk of having the syndrome earlier. Alcohol abuse also can. If you have decreased sexual frequency or abstinence, the vagina will shrink and actually get smaller. And so it will be more common that you have those symptoms of vaginal atrophy. And also cancer treatments, chemotherapy, pelvic radiation can also cause the genitourinary syndrome of menopause. What women mostly complain about with these symptoms, they complain a lot about vaginal dryness, loss of lubrication, dyspareunia, which is actually painful intercourse. There's vaginal bleeding and discharge with intercourse sometimes. They can have vulvar burning, dryness, and irritation on the entrance. So when you start to have intercourse, when a man enters you, that area right around the external vulva can become very, very irritated and dry. Spotting or bleeding can occur after intercourse. You can have loss of libido and you can have less sexual arousals, and your orgasms can become less frequent and less intense. Recurrent urinary tract infections can occur. We often see urge incontinence, which is when women when they lose their bladder function just because they have the urge to go to the bathroom, and stress incontinence, which is when women go to the bathroom without meaning to, when they cough, sneeze, laugh, jump around, exercise, and the symptoms can range depending on the person. So the impact of the genitourinary syndrome of menopause on sexual function is quite significant. People, 63% of women complain about not being able to enjoy sex as much as they used to. Spontaneity of intercourse, of course, is something that they complain about too. It's not as spontaneous. Some people can't even be intimate with their partner. They have difficulty just even having intimacy, and that obviously will affect the relationship with their partner. So when women are interviewed about these kind of things, you really see how sexual dysfunction can affect the relationship with their partner, with their husband, and really has an effect on the woman and how she feels about herself. So how menopause impacts your vagina, that's one of the number one things that we talk about with women who are postmenopausal who have these problems. Estrogen is the hormone that keeps your vaginal walls lubricated. At menopause, your estrogen levels decrease and the vagina becomes drier. As the vagina becomes drier, the lining of the vagina, the skin in the vagina also becomes thinner, and it also becomes drier. And that can cause vaginal itching and vaginal burning. As a result of the skin becoming thinner, and it's more fragile, and you can have tearing or bleeding during sex. And what I tell women is the less you use your vagina, the more these symptoms are going to happen. You really need to continue to have vaginal intercourse because that will allow the vagina to stretch. It will allow the vagina it increases blood flow and moisture, and it allows the vagina to stay at a certain diameter so you can continue to have intercourse.
So at this time, what I'd love to do is in the chat, based on what the information you have heard already, or if you had questions prior to and did not put them in the survey, we would love to hear, get your questions. I will put them in the chat and I will read them out to Dr. Hamilton. And then if you come up with some more later on as we finish out, we'll have another opportunity to ask questions again towards the end. So if you have any questions, we'll take a few minutes, put them in the chat, and we'll have Dr. Hamilton answer them for you.
I'm very used to questions, so I'm happy to have them.
All right, question. Is estrogen the only natural way to improve dryness?
We'll go over some modalities. So estrogen, vaginal estrogen you can use. There are some oral pills that you can use, and there's also a laser therapy that you can use to improve vaginal dryness. Lubrication will improve it in the moment. It's not a long-term, something that will help it long-term, but lubrication, when you're trying to have intercourse, using lots of lubrication also helps.
Question, what is the best form of contraceptive to use as you get older?
Well, I mean, if you're talking about menopausal women, we don't have to use contraception, which is actually pretty great, kind of allows you to be a little bit more spontaneous and free. But other women, you know, depending on what their symptoms are. So if you're having irregular menstrual cycles and hot flashes, oftentimes we'll prescribe a low dose birth control pill because that will actually reduce your hot flashes. It will make your periods normal, and it will reduce a lot of the symptoms that women have during the menopause. You can actually use birth control pills until age 55. So that's something that people do to help with their symptoms as well as with vaginal dryness. Also, IUDs are very good methods of birth control. They are long acting and they just stay inside your uterus. And it's a very easy way to use to have of contraception.
Thank you. Question. I've started using Lady Sweet to help with dryness. Do you know about this product?
I do not. I've never heard of that product, but if she'd like to send an email to me, I'm happy to look it up.
So yes, if you could send it to me and I will forward to Dr. Hamilton. And the two of you can communicate on that one. Question. I frequently get severe headaches during sex, before and during orgasm.
Well, I don't really know what would cause that. That's kind of an interesting problem. I mean, I would probably tell a patient who had headaches during orgasm to try to self-medicate prior to taking some Tylenol or ibuprofen. And then if that didn't work, I don't know what would be happening at that moment that would cause a headache. I guess they could maybe go see a neurologist or something. I'm not really familiar with something that would cause a headache immediately during orgasm.
Okay. Question. I'm 40 and stopped having a period at 37. I am on HRT and bleed and spot nonstop. All tests are negative. What could be causing the bleeding?
Most of the time when you're on hormones and you're causing bleeding, if your tests are negative, it's just benign. So what happens is the lining of the uterus inside the uterus becomes very thin. And because the lining of the uterus is so thin, you just have like chronic spotting. That's something that we see commonly with people on low dose birth control pills, and hormone replacement therapy is actually a lower dose than birth control pills. It's fairly uncommon to bleed constantly. A solution to that would be maybe to talk to your doctor about having an ablation. An ablation is when a doctor takes you to the operating room and does a outpatient procedure on you, and they put a little instrument inside your uterus and they will actually cauterize, which means burn the lining of the uterus, and then that way it can't bleed.
Any more questions? Okay, if we will start again, Dr. Hamilton.
Okay.
Thank you.
I think we're on the next slide, Angela. So the ways menopause impacts your vagina, it can shrink in size actually. So lack of sex can change the shape of your vagina. The vagina is comprised of muscle tissue on its skin on the inside, but it's surrounded by muscle. So if it's not used frequently, it can shrink and lose tone. The best way to prevent this from happening is actually to have vaginal intercourse. And you can also do masturbation with penetration, meaning putting something inside your vagina while you're masturbating. And there is definitely a use it or lose it type effect where if you're not using your vagina, it's definitely going to shrink. If it's painful, you can do vaginal moisturizer or a water-based lubricant. They also have vaginal dilators. If you go on Amazon, they have dilators where you can increase the size of your vagina with these vaginal dilators. It's a kit actually, and you use lubrication and you put the smallest one in, and then you do that for a week or two, then you do a larger and a larger one. I've actually had great success with patients using vaginal dilators. Between 17 and 45% of postmenopausal women might find sex to be a painful condition, and that causes again the vaginal thinning and dryness. And besides that, though, the way you feel about yourself as you go through the menopause can really affect the way you feel about yourself, the way you feel about your sex life, the way you feel about how you are during sex, and that can really affect your ability to have sex with your partner. So painful sex is generally caused by low estrogen levels, as we talked about before. The tissue gets thin and dry and fragile inside your vagina, also outside your vagina on your vulva. You can have what's called pelvic floor dysfunction, where the muscles surrounding the bladder and the vagina can spasm, or they can just become weaker. If you're not having sex, people avoid things that hurt. So they're sometimes not having sex, but if you're having sex, actually having intercourse is good for your vaginal health. It keeps blood flow going. It keeps those pelvic muscles using them, and it strengthens your vaginal tissue. Medical problems that can cause you have a lower libido include heart disease, diabetes, and high blood pressure. All those affect sexual function. And other things that can dampen desire. People forget about foreplay. We get very used to our partners and we don't use foreplay a lot. And that can really help lubrication and help excitement. If you have relationship problems, depression, stress, worries, things like that, that can also dampen your desire. For women, libido is not just a desire to have intercourse. It is often tied to how we feel about ourselves, how we feel about the aging process, how we feel like our partner feels about ourselves. And it's such a complicated issue that there are really a lot of things you really have to think about when you're thinking about your sex life. If it's not really what you want it to be, it's not just maybe you're having painful intercourse. It could be, a product of weight gain. It could be a product of just how you feel as you've aged. You don't feel as young anymore or as vibrant anymore. And those are things that you kind of have to address with yourself in order to have a more productive and better sex life with your partner. So as you age, the lower estrogen levels can cause the vaginal lining to be thin, but it also causes the urinary tract to lose volume. So what that means is that you can't fit as much urine in your bladder. You can get more frequent vaginal and urinary tract. The urinary tract, actually, you get more urinary tract infections, and you can have more frequent urination. Treatments for these issues are vaginal moisturizers as well as lubricants. You can also use local estrogen therapy. There are a lot of creams and tablets you can use. You can use systemic therapy like hormone replacement therapy, and you can use selective estrogen modulators, which actually just treat the vagina alone. I think we're going to get into this in the next slide. So treatment for sexual problems. So activity, regular partner activity, non-intercourse sexual activity. And you can also use pelvic physical therapy. Pelvic physical therapy is something that's really not used very commonly. A lot of postpartum women now are looking at pelvic physical therapy because after you deliver a baby, or even if you have a C-section, sometimes our pelvic floor muscles are really affected by that. So we see a lot of postpartum women now being recommended for pelvic physical therapy, but it's also good for women who are older. It helps us really identify the muscles that will help with urinary retention, to help you hold that urine in. It will help you have a better orgasm, and it will help you just kind of know where those muscles are and use them so you have better vaginal tone. For painful intercourse, we have non-hormonal products, so vaginal lubricants. They have long-acting vaginal moisturizers on the market. You can use topical lidocaine if you have an area that is really painful. I've had patients just have one area, they use a very small amount of topical lidocaine, and that is a numbing medicine, and you can use that in one area so you don't feel that pain right there if sex is otherwise pleasurable. There's also a laser. There's several lasers on the market. At our office, Charleston OBGYN, we have a laser called the Mona Lisa laser. And what that is basically is it's a laser just like people use on their face, but we put it in the vagina. It was originally developed in Italy for breast cancer survivors. Breast cancer survivors can't take estrogen. And so there was really no treatment for them to help with painful intercourse besides lubricants. Lasers actually, what you do, it's a non-painful procedure that takes about 5 minutes. You come in the doctor's office and you put your feet in the stirrups, and we actually insert this tube in your vagina and slowly move it out, and it lasers the vagina inside and around as you pull it out. What that does is it makes the lining of the vagina shed, just as if you had the skin do it on your face or something. It allows it to shed, and then the new estrogen, the new epithelium comes in, and that recruits collagen and elastin. I saw a question about the price of the laser. The laser is different for different, you just have to shop around. At Charleston OBGYN, we charge, you want to do 3 laser treatments 6 weeks apart. Each laser treatment is $500, and we allow you to pay per laser treatment. And then you would need a touch-up once a year, and that is $400. We're going to run some specials on the laser at our office just to kind of encourage people to do this. It's a great thing for particularly women who've had breast cancer or women who don't want to use hormones. Hormonal options, of course, you can actually use systemic estrogen therapy, which means you take it orally. So you can take hormone replacement therapy. There are risks and benefits to that. Some women like to take that. Some women don't want to take that. If you don't want to do that, you can do vaginal estrogen therapy. Vaginal estrogen therapy comes in different types of, you can do pills or you can do creams. And you actually put those in your vagina about twice a week, and the cream melts. And what it does basically is the vagina absorbs that estrogen, and it allows the vagina to be a little bit thicker and doesn't cause that painful intercourse quite as much. So that is something that is really helpful to women. If you're a breast cancer survivor, you cannot use the vaginal estrogen, and so we tell patients not to use that if they're breast cancer survivors. Vaginal DHEA is another thing that you place in your vagina. It's actually just like vaginal estrogen therapy. It's actually a pill called Intrarosa. DHEA is actually the body turns it into estrogen and testosterone, so that helps. And there's an oral estrogen called Aspina. There's an oral, pill called Aspina. And what that pill does is it actually selectively helps the vagina only. And so you can take it orally, and it can help with vaginal atrophy. That pill we used to use a lot, but we really have found that the local estrogen therapy probably works a little bit better if you're a candidate for it.
Dr. Hamilton, I know this isn't a question section, but we did have a question on the laser, whether or not it will create keloids. We have
No,
one.
it will not create keloids, no.
Okay, great. Are you taking patients in the West Ashley area?
Yes, actually, my office is in the West Ashley area, and yes, I'm taking patients.
Okay, awesome. I just wanted to get that while we were on that and top of mind. Okay.
Okay. So again, as we talked about, sex is not just about your vagina. It's about how you feel about yourself. So if you're not feeling good about yourself, you're really not going to want to have sex. And so things you can do to increase your interest in sex and your sense of well-being, and also a sense of control. I think as we age, we feel less in control of our bodies and less in control of our health. I know I certainly did when I was diagnosed with breast cancer. I always felt like I was healthy and did well. And all of a sudden I got this diagnosis, and it really impacted the way I felt about myself. And so what I do to kind of calm myself and decrease my anxiety about it, and and to help me gain control, I exercise, I eat a healthy diet. Losing weight, if you have weight to lose, is obviously something that you can do. Stopping smoking is a great way to kind of feel back in control of yourself, and actually to help your body all overall. Heart disease, vaginal dryness, menopause, everything. If you can stop smoking, if you're a smoker, that just can improve your health so much. And trying to get enough sleep. So talking about sex with your partner, of course, is a very sensitive subject. It's difficult often for people to bring these things up with their partner. So what we want to tell patients is make sure you're feeling relaxed, make sure you bring this up in a positive way. You might want to think about what you need to say and plan on, as opposed to just having a spontaneous conversation, because sometimes those conversations derail into problems that you're having with your partner or other kind of subjects. So really make sure you stay on task about what you want to talk about. Make sure the tone of your voice is right. You don't want to be accusatory or angry. You really want to speak from the heart. I think all of us in long-term relationships or in short-term relationships really want to hear from our partner. They really want to hear about what our partner cares about. And you're in a relationship for a reason. You're in a relationship because you want to please that person. You want that person to please you. So really make sure that you're speaking from the heart, and you're talking about what you need for you to really be sexually active and happy. You want to respect your partner's boundaries. If your partner's not comfortable with something, you need to, or if you're not comfortable with something, your partner's asking you to do it, you really need to respect boundaries with each other. And I tell patients all the time, sex is not just physical, it's mental and emotional. And it for women particularly, it brings in so many parts of our relationships. So therapists often can help. They have sex therapists, and they have their marriage counselors, relationship therapists, and that they can often help you get over the humps, get over the problems that you're having with your sex life. Things to improve your self-esteem, of course. I think we've all heard these. Stop comparing yourself to others, practice self-care, really treat yourself as others treat you, practice gratitude and working on your inner self. I think that's kind of all over the internet now about how to really kind of treat yourself and treat your body, talking to yourself in the mirror, saying positive things to yourself. I tell my daughters to try to say 3 positive things to themselves in the mirror every day, which, I don't know that they do that, but I think it's a nice thought. And when I get down on myself, I really try to think about positive things about myself. And I think that kind of helps to improve how you feel about yourself, which obviously will just help in everyday life, but also in your sex life. So now, to spice up your sex life, getting a little racy here. So tips for better orgasms: a Kegel squeeze. A Kegel is the muscle that you use to stop urination. So if you want to know how to do a Kegel properly while you're urinating, you stop urination, and that's the muscle that you need to squeeze to really help you have a satisfying orgasm. Lubrication, again, is your best friend. There's all types of lubrications out on the all over the place. There's KY, which I think is a water-based lubricant. There's glycerin-based lubricants that often work a little bit better. They're not quite as well absorbed. A lot of people use coconut oil. I've had some patients tell me they use vitamin E on their external vagina because they use the pill and just squeeze it on their vagina just to kind of lubricate it a little bit. Focusing on foreplay, of course, can help with orgasms. Using different toys. That is really helpful, if you can use a vibrator or different things to kind of spice up your sex life, make it a little bit more exciting, get direct stimulation to your clitoris. There's all different kinds of vibrators on the market. If you are embarrassed, most of them, well, they come, if you buy one, they come in packages that are, nondescript. It's not going to say vibrator on the front. So you don't have to worry about, what is going to, if your neighbor's going to know it, is your mailman going to know what you're getting? And then some people like different forms of erotica. So looking at pictures or looking at films and things like that might help. Some people like to wear lingerie. That's another way to kind of spice up your sex life. That builds self-confidence. It makes you feel powerful because you're in control. And of course, it helps with you being more seductive and feeling more seductive to your partner. And I'm sure your partner would really enjoy that, because that means you're making an effort. You're making an effort to make your sex life better. And I think all men like that, or women. So different positions, you can try different positions. Some people are better at this than others. I think a lot of times in long-term relationships, positions become rote. People do the same thing over and over again, but there are different things that you can do to kind of control how sex feels for you. So by switching positions, you can adjust the depth and the speed of penetration, and you can hit different erogenous zones. There are erogenous zones in your vagina as well as your clitoris. So missionary position is our most common sexual position, but cowboy and cowgirl, which is more like the man on top or the woman on top, and that can actually help you control the depth and penetration of the penis. And then doing doggy style from behind, that also can help you control the deeper penetration. And so that can help with the vaginal erogenous zones. Also, making your bedroom the right kind of place, using different types of tools to create a good atmosphere, music, candles, kind of doing things, massages, oils, whipped cream, whatever it is that you want to choose to do. I mean, whatever makes you happy, and makes you guys explore things better is always something that can help you spice up your sex life. Again, using lingerie. Another thing to tell patients is really not to watch TV in the bedroom, because once you're watching TV, no one's going to turn around and have sex. You're completely distracted. You're thinking about other things. And there's no bigger turn off than turning the TV on when your husband, comes in bed. So, if you want to avoid sex, that's one way to do it. But what we want to do is we want to increase our sex lives. So of course, we don't want to watch TV in the bedroom if we can avoid it. So again, if you're having problems with sex, you need to talk to your doctor. You can't be embarrassed to raise sexual issues. We expect you to talk about them. We want you to talk about them. We want to be able to help you. Our goal as obstetrician gynecologists, this is the gynecology part of our career. And this is the part that we really want to help women as they get older, to enjoy themselves and to feel good about themselves. And part of that is having an active and healthy sex life and having an active and, a really good relationship with their partner. If you are a lesbian, gay, bisexual, transgender, we don't care. We just want to help you. We want you to, live your best life. We want to help you be able to do that. We want to give you resources to be able to find the ways that will help you become the best person that you want to be. Your doctor can give you guidance as to how to continue and have an active sex life, maybe make it better. And your doctor may want to discuss your current issues, your sexual and medical history. Of course, when you come in for a session with your doctor, they're going to want to examine you, particularly if you have vaginal atrophy. If there are certain areas that are painful, they're going to want to know about them. They're going to want to look at them. They're going to want to talk to you about underlying health conditions that can contribute to sexual dysfunction. And they may refer you to a counselor or therapist. There are sex therapists in Charleston, and they do a good job of really trying to help you figure out how to make your sex life better. So these are kind of questions that you can ask your healthcare providers. So this might be helpful just for you guys to have, just to be able to ask what to prepare for, as well as how to have the doctor help you improve your sex life. So you can just ask general questions. Will menopause affect my sexual functioning? I think the answer to that is we don't know, because we don't know how women go through the menopause. Some women go through the menopause beautifully and never have any problems with sexual function. Some women have a lot of problems with sexual function. You know, I always ask patients, how was your sex life prior to menopause? You know, if they complain about having low libido, did they have low libido their whole lives? Was it once really, really great? And then as time's gone on, has gotten less frequent and less great. So a lot of your history in your relationship is very helpful. You can ask your doctor what causes sex to be painful, which we, of course, have gone over ad nauseum today. Is painful sex preventable? I think the answer is probably. It's not always a yes. I think it's for a lot of people, yes, painful sex is preventable. For some people, it's not always going to be preventable, but we can certainly help with the tools that we have. Are there any types of complementary therapies that can improve your sex life after menopause? Again, foreplay, using different positions, being creative, talking to your partner, you know, the questions that you talk to your partner, how to talk to your partner, how to, you know, talk to your partner about what to expect, the future. And if your partner has questions that you can't answer, we can, of course, help you answer them. Your partner, if it's a male, can go see a urologist. A lot of men have sexual issues as they age. They're on medications that cause problems with being able to, with with them being impotent. And so, you know, there are things that men have issues too, and urologists are actually the one that help men with, they give them testosterone often, they give them medications like Viagra to help with those problems. And, you know, men are embarrassed about this also. So you opening up to your partner and you talking to your partner can really help them start the conversation. And the question, should you see a specialist? I mean, an OBGYN, I don't know that I consider myself a specialist, but I think OBGYNs can generally take care of most of these things. And a urologist for a man is really where you want to go. And I think that's it.
So before we go into resources, let's take some more questions. There's a question that came up in the middle of your presentation, Dr. Hamilton. I have long-term insomnia that began at menopause. What have you seen that works?
For long-term insomnia?
Yes.
You know, I mean, a lot of people will be on medication for insomnia. We don't really, as OBGYNs, we don't really prescribe medication. I think a internist can prescribe medication for you if that's the route that you want to go. There are people who will do sleep studies on you. So there are pulmonologists who will actually bring you in and do sleep studies on you, and they can actually see if there are problems physically that are causing insomnia. Some people have health issues that cause insomnia. You know, obesity can be a problem with that. And, you know, what I don't sleep very well. So what I tell patients is what I try to do is I fall asleep very well. And usually I wake up in the middle of the night and I'm awake for quite a while, but I have white noise machines. There's also different things on the internet that you can use called like, I can't remember what it's called, but there's a machine that you can use that you can watch, and it actually will help you take your mind off the fact that you're not sleeping, and it can help you fall back to sleep. So I think there are some things, obviously not watching TV, not using your computer, not getting on your phone. All those things are, you know, do not help with sleep at all. And having like a healthy sleep pattern, you know, as you do with your children, taking a bath, being, you know, getting in a calming environment, you know, kind of doing some self-care prior to going to bed can help you, I think, sleep.
Excellent. Do you have a therapist that you can recommend?
There is a sex therapist in Mount Pleasant that we often recommend. Her name escapes me right at the moment. And oh, I can't believe I can't remember her name. I refer to her quite often. But if you looked up sex therapists on the internet, she is in Mount Pleasant, and actually she has come to our office and given a lecture to our patients when we're doing the Mona Lisa laser. In conjunction with the Mona Lisa laser, she came and did that. But if you look it up, if you look up online, some therapists will specialize in that, and they will be able to, you'll be able to see that.
Okay, and please talk more about the role of thyroid problems.
Thyroid problems in terms of in terms of menopause.
Yes.
So thyroid dysfunction can cause you, if it's untreated, can cause you to have problems just all over your body. And so thyroid dysfunction needs to be treated. And so if it's not treated, it can increase your risk of going through menopause early.
Suppose you're more lubricated during menopause than dry. What causes that?
Well, I would consider myself lucky if that was the case. And I mean, if you're in a monogamous relationship, obviously, if you're having excess vaginal discharge, you should go to your doctor just to make sure that you don't have any kind of infection or anything like that. But your vagina is supposed to make, your vagina is made out of cells, just like your mucous membrane in your mouth. Your mouth makes spit. Your vagina is supposed to make lubrication. And so that's just a natural process. I would just be happy.
Absolutely. Any more questions? That was our last question on the chat before we move forward. Does anyone have any more questions? If you do, as we're continuing, go ahead and put in the chat and I'll come back to it. So this is a list of resources that we will provide that will help you throughout with this topic if you want to do some research. This resource slide, as well as questions to ask your doctor, I have as attachments. So I will send those to you after the session, as well as a post survey of what you've learned today. And if we just asked if you could answer the questions, get the survey, get some feedback on the presentation, the information, and Dr. Hamilton, that would be great. And then just some upcoming sessions. Our August session is taking that should be an alternate route. Osteoporosis and menopause in September, and then October, sleep and menopause. Someone just asked about that. Awesome. So if you haven't registered for these, please visit rsfh.com/calendar and put in Red Hot Mamas, and that will bring up the section for you to register for these remaining classes. I have a question. Hold on, please. Thank you so much, Dr. Hamilton. Very informative presentation. We thank you
for joining.
Let's see. Do I have any more housekeeping? Oh, this has been recorded. I will have it converted into YouTube video, and when that is completed, I will have that link sent out to everybody in attendance and that registered as well. Another question. We have another. Thank you, Dr. Hamilton. Excellent. So I'm going to let Karen close us out. She's going to talk a little bit more about Red Hot Mamas on this slide, just to show you what's the word? We are not the doctors. Dr. Hamilton is. This is information. You are to go to your doctors for more information. So Karen, do you want to close us out with anything else Red Hot Mamas related?
Well, we're just so pleased to have these programs, and each one, each program is different. And so we would like to hear from you to if we haven't have a subject that is on your mind that we haven't covered yet, or that we're going to cover in the next 3 months, we'd like to hear what new programs you would like us to focus on and provide you with. And you can write that in the chat room now if there's anything that is on your mind that you would like to see us cover in depth and have a speaker speak on it, because we designed these programs with you in mind to make sure that you have the healthiest menopause that you possibly can in your postmenopausal years too. So please let us know. That's important in this. If you can write in the chat room what you'd like us to cover if we haven't covered it so far.
And I wrote myself a note for Dr. Hamilton for your Mona Lisa special. When you run those, is that something that you would like, information that you would like to get out to this group?
Yeah, that'd be great.
Okay, so when you have that information, you can send it to me and I will forward that to your attendees.
All right, would love to. Thank you.
Oh, you're welcome. One more question. Is there a way to get recordings of previous sessions? Absolutely. I will get those to you. Send those. Let me know if you need all 4 and I can get those to you, Katrina. Yes. Another thank you, Dr. Hamilton.
Oh, thank you. I appreciate it.
Any more? And we are going to give you back some time today, almost 33 minutes. Awesome. Thank you, Dr.
Bye.
Hamilton, so much. Very informative. I learned something myself from you and from the slides themselves. Another one, thank you. I like previous sessions too. Okay, so have a great rest of the week. And as soon as the YouTube link is available, which will probably be next week, I will get those out to everyone. And I look forward to seeing you guys in August.
All right. Thank you so much.
Thank you. Bye-bye.
Bye, Karen. Thank
Bye
you.
now. Thank you.
Thanks, everyone.
Bye now. I hope you've enjoyed it.